Understanding strokes is crucial because they are indeed a serious health threat. A stroke occurs when blood flow to the brain is interrupted. This can happen due to a blockage in a blood vessel or a rupture in a blood vessel. Strokes are a serious medical emergency. They can cause lasting brain damage, long-term disability, or even death. Timely recognition and treatment of a stroke are crucial. Knowing the signs and symptoms can mean the difference between a full recovery and a lifetime of challenges. It is vital to seek immediate medical attention if you suspect someone is having a stroke. Strokes are a leading cause of death and disability worldwide. Understanding the warning signs and seeking prompt medical care can significantly improve outcomes for those affected. By learning about strokes, we can all play a part in reducing their impact. Remember, time lost is brain lost. Act fast at the first sign of a stroke. The FAST acronym is an easy-to-remember tool for quickly identifying the common signs of a stroke. It stands for facial drooping, arm weakness, speech difficulties, and time to call emergency services. Facial drooping is often one of the most noticeable signs of a stroke. Ask the person to smile and observe if one side of their face droops. Arm weakness can manifest as difficulty lifting one or both arms, or a feeling of numbness or weakness in the limbs. Ask the person to raise both arms and see if one arm drifts downwards. Speech difficulties can range from slurred speech to complete inability to speak. Ask the person to repeat a simple sentence like, "The sky is blue," and listen for any difficulties. Time is of the essence when it comes to stroke. If any of these symptoms are present, even if they are fleeting, call for emergency medical help immediately. Remembering the FAST acronym can equip you with the knowledge to act swiftly in a potential stroke situation. Early recognition and prompt action can significantly improve outcomes for stroke victims. While FAST is a widely known acronym for stroke identification, the BE-FAST method provides a more comprehensive approach by incorporating two additional crucial indicators: balance and eyesight changes. This expanded method enhances our ability to detect strokes early on and seek prompt medical attention. Balance issues such as sudden dizziness, loss of coordination, or difficulty walking can be indicative of a stroke. These symptoms may arise due to disruptions in blood flow to areas of the brain responsible for balance and coordination. Eyesight changes such as blurred vision, double vision, or sudden loss of vision in one or both eyes can also signal a stroke. Incorporating these additional indicators into the BE-FAST method allows for a more comprehensive assessment of stroke symptoms. By remembering BE-FAST, balance, eyesight changes, facial drooping, arm weakness, speech difficulties, and time to call for help, individuals can be better equipped to recognize a stroke and seek immediate medical attention, potentially improving outcomes for themselves or others. Strokes manifest in various ways, often with a sudden onset of symptoms that vary depending on the area of the brain affected. While the FAST and BE-FAST acronyms cover the most common signs, it's essential to be aware of other potential indicators. Sudden numbness or weakness in the face, arm, or leg, particularly on one side of the body, is a hallmark symptom. Confusion, trouble speaking or understanding speech, and severe headaches with no known cause are also red flags. Additionally, difficulty walking, dizziness, loss of balance or coordination, and sudden vision problems in one or both eyes warrant immediate attention. Less common, but equally concerning symptoms include sudden severe headache, nausea, vomiting, and altered consciousness. It's crucial to remember that stroke symptoms typically appear suddenly and without warning. If you observe any of these signs, even if they are temporary or seem to improve, seek emergency medical help immediately. Strokes are broadly categorized into two main types, ischemic and hemorrhagic, each with distinct causes and implications, and we are delving deeper into the factors behind both. Understanding the difference is crucial for effective treatment and prevention. Ischemic strokes, accounting for the majority of cases, occur when a blood clot blocks an artery supplying blood to the brain. This blockage deprives brain cells of oxygen and nutrients, leading to cell death and potential brain damage. Hemorrhagic strokes, less common but often more severe, happen when a weakened blood vessel in the brain ruptures. The bleeding within the brain compresses surrounding tissue, disrupting brain function and potentially causing life-threatening complications. Identifying the type of stroke is essential for determining the appropriate treatment approach. Prompt medical attention is crucial in both cases, as timely intervention can minimize brain damage and improve the chances of recovery. Identifying the vulnerable involves understanding the risk factors and preventive measures for stroke, as certain factors significantly increase the risk despite strokes potentially affecting anyone. Understanding these risk factors is crucial for implementing preventive measures and promoting overall health. Age is a significant factor, with the risk doubling every decade after age 55. Family history of stroke, personal history of stroke or transient ischemic attack, and medical conditions like high blood pressure, high cholesterol, diabetes, and atrial fibrillation all contribute to increased risk. Lifestyle choices also play a role, with smoking, lack of physical activity, unhealthy diet, and obesity significantly increasing the likelihood of stroke. Fortunately, many of these risk factors are modifiable. By adopting a healthy lifestyle, managing existing medical conditions, and seeking regular medical checkups, individuals can significantly reduce their risk of stroke and improve their overall well-being. Timely intervention for stroke patients involves treatment options that depend on the type, severity, and location of the event, with swift medical attention being crucial to improve outcomes and reduce long-term complications. For ischemic strokes, clot-busting medications like intravenous tissue plasminogen activator are often the first line of treatment. These medications work by dissolving the blood clot and restoring blood flow to the brain. In some cases, a minimally invasive procedure called mechanical thrombectomy may be used to remove the clot directly. This procedure involves threading a catheter through an artery in the groin and guiding it to the brain to remove the blockage. For hemorrhagic strokes, treatment focuses on controlling bleeding within the brain. Medications may be given to lower blood pressure and prevent further bleeding. In some cases, surgery may be necessary to repair the ruptured blood vessel or relieve pressure on the brain. Rehabilitation is a crucial part of stroke recovery, regardless of the type of stroke. This may involve physical therapy to regain mobility and coordination, speech therapy to improve communication skills, and occupational therapy to relearn daily living activities. Transient ischemic attacks, often called mini-strokes, are significant because they involve temporary episodes of stroke-like symptoms caused by a brief interruption of blood flow to the brain. While TIAs typically resolve within minutes or hours, they should not be ignored, as they often serve as warning signs of a potential major stroke. The symptoms of a TIA are similar to those of a stroke but are usually temporary and resolve completely. These symptoms may include sudden weakness or numbness on one side of the body, slurred speech, vision problems, dizziness, and loss of balance. Although the symptoms of a TIA are temporary, it is crucial to seek immediate medical attention if you experience any of these signs. Prompt evaluation and treatment can help determine the cause of the TIA and reduce the risk of a subsequent, more severe stroke. TIAs provide a valuable opportunity for early intervention and stroke prevention. By heeding these warning signs and seeking medical attention, individuals can take proactive steps to protect their brain health and reduce the risk of long-term complications. The urgency of action in stroke care cannot be overstated, as every passing minute without treatment can lead to irreversible brain damage and life-altering consequences. Acting quickly at the first sign of a stroke can make all the difference in recovery. When a stroke occurs, brain cells begin to die due to lack of oxygen and nutrients. The longer the delay in treatment, the greater the extent of brain damage and the higher the risk of permanent disability or death. Immediate medical attention is crucial for minimizing brain damage and maximizing the chances of a good outcome. By recognizing the symptoms of a stroke and calling 999 immediately, you can help ensure that the affected person receives timely treatment and has the best possible chance of recovery. Remember, every second counts. Don't hesitate to seek help if you suspect a stroke. Your quick action could save a life.